It's amazing. We know that we're at risk of DVT, of deep vein thrombosis, when we fly. The airlines have done a good job at telling us that. What people didn't know is that you're 100 times more at risk of getting a DVT in hospital. And so what we needed to do was raise that awareness and make sure that we had the right processes and systems in place in our hospital.
Venous thromboembolic disease, or VTE as you've used the acronym there, refers to clots. Clots in the legs, clots in the lungs. A problem that we have is we know that we have mechanisms in place that can treat them. For example, using appropriate devices such as calf compressors and using pharmacological methods like Clexane or other agents to reduce that risk. But we have a difficulty of trying to translating the evidence into actual clinical practice.
So this project was looking at both the surgical and the medical patients and trying to do a better broad spectrum treatment for every patient.
We had a whole of hospital approach. We had management, pharmacists, physicians, nursing staff, and we had consumer representation as well. Patients were on the project. And so together we could solve this whole of hospital problem with a whole of hospital approach.
As part of the program, we have run several workshops on VTE prevention, and I prepared a PowerPoint presentation which highlighted the importance of prescribing of anticoagulants, and it also gave dosing guidelines, drug interactions, individual patient risk factors.
We've seen some really fantastic improvements. We've had a 20% increase in our compliance with the evidence-based guidelines. But probably one of our most significant improvements is that we've laid the groundwork. We have the structures and processes and systems in place. So now that we have those in place, we can really start to improve on our compliance rates.
We're never going to, unfortunately, get 100% compliance, but we can try to get as close as we can. And I think 20% is fantastic, but that's not where we should stop. We should aim to get our compliance as close as we can to 100%, and if we're not, we've got to look at why.
We've shown that we did have a problem, we've done some research, we've brought in a policy, and then we've run with the policy and we've improved.
This project represents our value of excellence. So we're trying to be the best that we can in VTE management, and with the help of our whole team, I think that we're well on our way.
So these calf compressors, they do one leg at a time. So it'll pump one leg up for 48 seconds and then release, and then it'll go to the other leg. So it'll go one leg at a time.